So, my name is Daniel, and this is my physical examination of the head, nose, mouth, and just of the heart sounds, and also just of the chest, the posterior and anterior sides. So, first off, gonna inspect the lips, the buccal mucosa, the tongue, and the gums. Just want to note the color of them, like the moisture of them. See if there's any bleeding, if there's any lesions. Want to note any sores. Look to see like if there's any Koplik spots, like little white spots. Gonna also look to see if there's could also maybe be like a yeast infection, like white, like thrush. Um, when you're looking at the gums, just want to look to see if there's like any like bluish black line. Also look for hyperplasia to see if the gums are kind of puffy over the teeth. Um, Looking at the teeth, you also just want to note the number of teeth they have. Look just at the color of them, the condition of them. Look, see if they have any cavities. And moving on to the tongue, you can just inspect the tongue. You can palpate it, see like the density of it, the texture of it. Look to see if it has any hair that can be indicative of like just their overall kind of like their hygiene. Note also to see if there's any yeast infection. Also look to see at the size and the shape to see if just they have a small tongue or a bigger sized tongue. Also, of course, for this, look for lesions and cancer sores as well. Then moving on to the throat, just want to look at the uvula and it's a hard word to say. It's like the palatus, or it's like the front, or it's like the it's like looking at the palate at the top. Sorry, that's a hard word to say. um, Moving on.
Should you not be doing it while you're talking?
Moving on to the nose, you just want to inspect the nose, just looking at the shape, look at the color, just look to see if there's any deviations. You want to palpate the nose, just noting any tender spots. And then you'd want to just also note that there's any, or make sure that they have like good patent airways, like just kind of close maybe one side and just make sure they're breathing okay through it, and then just close the other side. At the same time, you're also just noting the tenderness. If I had an otoscope, I would then inspect the interior of the nose, just looking at the mucosa to make sure it's good color, the moisture. Look to see if there's any perforations in the septum, also if there's any deviations. Look to see if there's any bleeding or lesions. So, moving on, she's going to turn, so just turn with your back to me. So, moving on to the posterior, the posterior part of the back, or the chest. So, you should first inspect the chest shape and the position, just looking to make sure that it's normal, like make sure that the positionings of the scapula are. Then you would inspect. I'm not, because it's my wife. I'm not gonna like. Normally they'd be in a gown, so you'd be able to see their back, but I'm not gonna do that since it's my wife. But I'm not gonna like. But normally I'd be able to see like their skin exposed. I would inspect their use of their accessory muscles, like when they breathe. Then I would inspect like the positioning, like their posture, and just like make note of how well they're able to support their weight while they're breathing. All right, so after that, you just would palpate their back, noting any tender spots, and also making sure note that they have sensation on their back, because that can be indicative of like any kind of maybe a spinal an issue with their spine if they're maybe having sensations in some spots but not other spots. With gloved hands, you would palpate any lesions or masses that are present. After that, you would palpate for fremitus, which you just use like the ulnar sides of my hand. So I put them on, and then you just would have the patient say 99, and you just would note the vibration. So just whenever you
99, 99, 99.
Okay, so yeah, the vibration just decreases as you go down. That's normal. Okay, so now I would palpate. Put my hands down around the T9 and T10 vertebrae, and just I'm noting for on the inhalation, like just kind of watch the thumbs move, just to see that there's like equal chest expansion. All right, yeah. So, and then next I'm just gonna move on to palpation. So, just gonna palpate across the back above the scapula. And then once you do that, you then just palpate across and downward in the intercostal spaces. Your shirt almost has like lines with it. And then you want to palpate down at the base of the lungs on the lateral sides. Or I'm sorry, you want to percuss. Or no, I'm sorry, palpate. Sorry. All right, so once you're done doing that, so got a stethoscope. So I'm not gonna put it over my ears just so I can still hear. But after this, you just auscultate for breath sounds. Just check for normal breath sounds, so just deep breath. All right. And then you would also auscultate for any adventitious breath sounds like bronchi or wheezing. And then after you auscultate for breath sounds, then you just want to auscultate for voice sounds. So you just repeat the same process. You're checking for bronchophony. So you just would do the same thing as what you did for the breath sounds, except this time you just have the patient say 99. So.
99, 99, 99, 99.
Okay, and then to check for something called egophony, you just would do the same thing to have the patient say E. So.
E, 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 E.
Okay, and then last one is it's called checking for pectoriloquy. So you just have the patient whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
And so now, if you would mind just to turn around and face me. So now we're just going to inspect the anterior side of the chest. So first thing you look at is inspect the chest and trying to measure the anterior posterior ratio or diameter versus the ratio of the transverse diameter. So a normal would be just a 1 to 2 ratio. So once you get that, then you would inspect. You inspect the use of accessory muscles from this, from this side. You would inspect from anterior and from around the side, like a lateral view. Inspect just the positioning of the sternum. You also would inspect the positioning of the slope of the ribs from both anterior and a lateral view. Right, so then, just like on the posterior side, you would palpate for. Sorry, you would just palpate for any like tenderness. Also palpate the side for any sensation or lack of sensation. Palpate for any masses, and then also just palpate any lesions. Then you would. You okay?
Yeah.
You okay?
Mm-hmm.
So. One thing I forgot to say about on the posterior side is you also would do what's known as palpate or percuss for a diaphragmatic excursion. So that's why you just on the posterior side you just would palpate or have them inhale, and you would palpate kind of down the diaphragm, and then you have them exhale, and you would palpate again. You're just trying to determine like the measure. You're doing a measurement there of like the diaphragm movement. Okay, so getting back to the anterior side, so you would palpate that. So just like with the posterior side, you would do fremitus on this side. So have them say 99.
99. 99. 99.
Sorry, that's awkward. Okay. So. So, sorry, had a brain freeze there. So, you'd also check for breath sounds. So. Okay. And then on the side of your chest, you're checking for chest expansion by just placing your hand on you want your thumbs to be kind of like at the slope, like the ribs as they angle up. It's like the interior. I can't remember. It's like you want to like where like your ribs kind of like the V. I can't remember the terms. You want it to be like kind of right there, yeah, within the xiphoid process. But then you're just looking to see like the thumbs, like as they expand equally. And then you're gonna just palpate or percuss the percuss above the clavicles, and just percuss the intercostal space down and across. So I'm not going to go the whole way down. Let's see. So if you want to just turn facing that way. Sorry. So now we move on just to doing a breast exam. So when first examining breasts, you just want to inspect, denote the symmetry, the color, the shape. You want to note if there's any like superficial, like there's any like vein or superficial veins, like any pattern to those. Want to make note of like the direction, like the nipple direction, and the size, color, and shape of areolas. Then, after you inspect them, you just would palpate, noting like any tenderness, the temperature, the texture. You'd palpate using just index finger and thumb. You could just note if there's any discharge from the nipples. Then you could also palpate if there is any, if they've had a mastectomy. You can make note of like any like remaining tissue like around the scar site. Notice if there's any lumps, any swelling, any redness, any tenderness. Um, uh, and then with a male patient, when doing a breast exam for them, just you can make note of the color, like of their nipple, or sorry, not you want to make like note like when you palpate, just to feel if there's any nodules or any ulceration or any swelling like around their nipples, around the areolas. And then for both male and female, you would so you just want to like note about the lymph nodes under the arm. So I'm gonna hold the elbow with one arm, and you just would palpate. Just palpate the nodes under the arm, in the armpit, and the axillary. So you got the anterior ones, and then there's posterior nodes. And then you would also just just palpate down the arm. And then you would also want to, before you do palpate, that was something I forgot to mention, you also just want to inspect, just to see like if there's any infection or any redness like in the axillary. Okay, so last one, just moving on to the moving on to cardiac, like the heart and the neck. So using a stethoscope, before palpating or percussing anything, you just want to auscultate the carotid on both sides, but just you want to auscultate the carotid and like listen for a bruit. Do it on the other side. And then you would want to one at a time, not both of them. You'd want to palpate. You want to palpate the carotid, just checking the elasticity of it, the amplitude of it, feeling for a thrill. And of course, checking for a pulse. And then once you're done with those, you would just inspect. Should have more light on this side. You just would inspect both sides of the neck, looking for looking for like the jugular venous pulse, and then you would measure the jugular venous pressure. And so that's I'm not gonna be able to do it here, but it's the process for that is you just would have them lay back at about a 45-degree angle, turn their head. So in this case, I'd have her turn her head to the left. And so you just make note of like, you find like the vein, you find the jugular, and then you measure outwards to like, it's like the sternal, it's about up your sternal, it's like the top of the sternum. I'm drawing a blank on what it's called, but you have an imaginary line go out to that, and then so wherever that is in centimeters, you add 5 centimeters, since like they're not going to be completely like level with each other. And so that measurement would be like you'd convert that into your jugular venous pressure. So once you do that, then you just moving down into the heart. So in this case, you would inspect any visible pulses. So in this case, if normal patient, I would have them, they would be wearing a gown, it'd be easier to, but you just would like note of like there's like an apical pulse, if you could see any carotid, jugular, or any radial pulses on the arm. So I'm just gonna use my fingers. I'm just gonna palpate for apical pulse.
Mhm.
So just looking to for also feel if there's any vibration or any abnormal feeling. So after you've palpated for one, then you just will auscultate for heart sounds. So the S1 sound is second intercostal space, right of the sternal border. So that's the lub sound. Okay, and then S2 is just second intercostal space, left sternal border. That's the dub sound. So just note the rate, the strength, like the intensity of it, and just the pattern. And then besides those, also just do the apical pulse, so down like at the apex. So also get a, you can also get, when you're palpating, also I forgot to mention, so get an apical pulse, and then get a radial pulse. And then if there's any difference in those, then that'll just be what we call a pulse deficit. So it should be about the same. I've rarely ever had any be different. Also, when you're auscultating, like for the S1 and S2 sounds, just make note of any extra sounds you hear. Really common ones is just I'll hear something like a murmur. So just like a kind of like a more of a swishing sound. And then so for all these like the heart sounds you did, like auscultating, like you would do these. So like right now, doing it in the sitting up position. You'd also do it having them lay on their left side. Do it while they're like leaning forward, and then also just like checking like or doing sounds like while they're exhaling. So, and that's it for this video.